My name's Tom Richardson. I'm a clinical psychologist, and this is my point of view about the link between money and mental health. Why is it that being in financial difficulty can have such a big impact on mental health and vice versa? So we've known, sadly, for a long time that people from poorer backgrounds, low socioeconomic status, are more vulnerable to different mental health problems. What I'm interested in is psychologically why that might be the case. So one of the things I did a few years ago was something called a meta-analysis, where you pull together all the numbers from the research that's been done before, and I wanted to see how strong was the relationship between debt and mental health problems. So this was unsecured debt like credit cards and car loans. And pulling it all together, what I found that if you're in debt, you're more than 3 times more likely to have a mental health problem. So about 42% of people who were in debt had a mental health problem. There were relationships for specific mental health problems like depression, problems with drink, problems with drugs, and sadly greater risk of suicide as well. Now there's the classic chicken and egg situation here. Which comes first? Which causes which? So it could be, for example, that if you are in financial difficulty, that has a big impact on your mental health. It could also be that if you have mental health problems, it's harder to hold down a job, it's harder to handle finances, so that might also make you more vulnerable to these difficulties. So one of the things I've tried to do in my research is try to look at what comes first by doing what we'd call longitudinal research, where you look at the relationships over a period of time. So for example, I looked with students, and what I found that struggling to pay the bill at the start of the study was linked with more symptoms of overall poor mental health, anxiety, greater risk of problem drinking, and greater risk of an eating disorder. But when you looked at it the other way around, those with poorer mental health at the start, they were more likely, sadly, for their finances to deteriorate over time. So I think overall I'd say what my research suggests is that the relationship is probably more that financial difficulties impact mental health, but it also works both ways as well. So why is this the case? Why is it that mental health problems can impact mental health? So there's research on a number of different factors here, and I think we still need to keep researching because it's fairly early days. One of the factors is self-esteem that I found in my research. So if you are in debt, you're not able to pay the bills, that can really impact your self-esteem. You don't feel confident, and that's going to make you feel anxious or depressed. What's also important is how much sense of control or agency you have. So if you feel like you can do something about your financial situation, that's better for your mental health. If you feel like it's out of my hands, I can't do anything about it, then that really can have a bigger impact. Being more active in your coping, so trying to get help, trying to get financial advice, that really helps kind of reduce the impacts of financial difficulties on your well-being. But unfortunately what happens is that a lot of people might financially avoid, for example, we all do it to an extent. End of the month, don't want to check my bank balance. Some people do that a lot more, especially if you're anxious. It's going to be really hard to open bills, it's going to be hard to concentrate, plan a budget. So sometimes maybe avoiding coping with the situation and kind of burying your head in the sand might also be a factor. What I find really interesting as a psychologist is we all assume that the bigger the amount of debt, the more impact that's going to have on your well-being. Actually, the research shows that often that's not the case. What's more important is not how much debt you're in per se, it's how stressed or worried you are about it. And I guess this makes sense when you think of it. For some people, £2,000 of debt isn't a lot. For some people, £200 of debt is a really big deal, and they will really worry about it. So it's how you make sense of it. There's also studies that, for my research, has shown that for students, for example, actually how much tuition fees you're paying, how much student loan you've got, that's not as important as whether you can pay the bills. So the most important thing is whether you can get by financially day to day. And when I've done research with bipolar disorder, we also found that the amount of debt you're in doesn't really impact mental health. It's how you feel about it. Do I feel like my situation's going to improve? Do I feel like it's always going to stay about like this? how stressed am I? Do I think it's going to get worse? So the psychological factors here around your finances are actually probably more important than how much debt you're actually kind of in. Some research I've also been involved in supervising, we've shown that there's a really important role for hope. So how much hope you feel about the future, and also shame. Whether you feel ashamed about your financial situation, that is a really important factor that can turn financial difficulties into depression, stress, anxiety. One of the things I've been especially interested in is researching about this complex relationship between money and mental health in bipolar disorder specifically. So if you look in the diagnostic criteria for a manic or a hypomanic episode, when people are high and impulsive, impulse spending is one of the actual diagnostic criteria. But there's actually not that much research out there, and I really wanted to try and work out again why there is this relationship. So everyone assumes that when you're high, when you're manic, you spend lots, you can get into real problems, but why? So we interviewed people, and we also looked at, gave them some questionnaires kind of a few months apart to try and look at these factors and pull it all together into a kind of model. And what we found, there was overspending was often reported, and this could be separated into impulsive shopping, so kind of buying things you don't need, kind of looking at your phone late at night and just going, oh, that looks nice. But there's also a theme which I hadn't expected of being really excessively generous. So people saying they shower their family with gifts, or they give loads of money they can't afford to charity, maybe when they're high, to be very generous to others as well. There's also this assumption that it's only when you're manic, it's only when you're high that you spend lots, but we found actually that that symptoms of depression, stress and anxiety in bipolar disorder, they led to impulsive spending over time. And for anxiety, it worked both ways. So people spent too much because they were anxious, and then that just made them feel more anxious, sadly. One of the reasons I think those kind of negative emotions are linked to it is something we picked up called comfort spending. So people report they bought themselves stuff to make themselves feel better when they're down. Might end up backfiring in the long run, because another theme is that people maybe feel guilty, so there's this whole kind of cycle where people feel down, they spend money to try and make themselves feel better, and then they regret it. We also find that mindfulness is something that a lot of people talk about. It's being more aware of what's going on, and we found that people who weren't as mindful, they weren't paying attention as much to what was going on, they were more prone to kind of impulsively spending. If you're kind of not aware of what's going on, maybe you just kind of run an autopilot and spend more than you mean to. Another thing was how people saw you was important. So people who were kind of worried about how people saw them, that was linked to spending more. But also this desire to achieve. So people with bipolar disorder can have quite high standards and set the bar quite high, and we found that having these thoughts that I've got to achieve, I've got to meet these goals, that was linked with this kind of spending as well. So I think what really stands out for me for bipolar disorder is that people often assume that when people are manic, when they're unwell, they buy just sort of whatever they see and it's random and impulsive and there's no method. And that might well be the case, but I think what my research showed was actually sometimes there is a reason for it. Sometimes it is to try and mend a relationship with someone or meet a goal. And I think for some people it can be a case of, I'm broke, I develop a get-rich-quick scheme or an idea to get me out of this financial hole, and then I spend money to make money. And it might be an overly optimistic idea, so that it can be a vicious cycle. So I'll give you an example from my own life. I have bipolar disorder. When I was 18 and I had a manic episode, I went into a shop and I bought like 5 African djembe, the big drums. And from an outsider, that might look like a completely random thing to buy. But in my mind, it wasn't random. It was linked very clearly to a goal I had, a business idea I had, which was to try and get me out of a financial hole. Now, that was a very unrealistic business plan, but it was for a reason. So I think in summary, it is complicated. There's lots of different reasons why money impacts mental health, and poor mental health impacts how you handle money. We do need more research. But as a psychologist, I can't change people's financial situations, I can't get rid of their debt. But what really gives me hope is that the research shows that financial variables, they are really important factors that turn financial difficulties into distress. So as a psychologist, if I can work with those factors, help people be more aware, help people face their fears, then this can hopefully break the link.